After the age of 40, the best investment in your health, particularly, it is your muscle mass. If you have muscle mass, you are a wealthy person, healthy wise. If you don't do the gym and if you're not doing exercise, muscle going to be dilute, and the weakness is going to happen, and that's more prone to having age related problem, arthritis, and joint health also not good. Correct. That is why we always tell you go gym, make the muscle. But don't make it excuse your husband, I have a back pain. My doctor told me 1 week. No doctor is telling for 1 week, and I'm not telling. Some of the husband calling me, doctor, what you told to her?
don't get out of the bed for 1 week. That is such a nice thing to say. I hope all the doctors approve that request. Welcome to the Marina Vibe Podcast, and today we have Dr. Ravi Khamar with us, who is into physiotherapy. How did I meet Dr. Khamar? That is also something we will know during the episode. Welcome, doctor.
Thank you, Marina. How are you doing?
I'm doing good. What about you?
I'm absolutely fit and fantastic.
Okay. So what are we going to understand today?
Of course, physiotherapy. This
Absolutely.
is the burning topic nowadays. People are asking. So, of course, we're going to talk about that.
And thank you, doctor, for choosing podcast as a method to come forward and showcase the work that you do back in your clinics.
Thank you. My pleasure. My pleasure to help spread the words. And at the same time, this is very necessary nowadays is I see in the patient. So that's why I want to just spread the words so I can reach to the right audience with right understanding to help them.
Perfect. Give us a little bit introduction in the BNI style, 30 seconds of what you really do.
So, mostly I see in my pitch, 70 to 80% people, today or tomorrow, they're going to suffer with a neck and back pain after the age of 40. And this is burning things. And this is status for 25 years ago. So nowadays you can see the stats are really high. So this kind of people, if they're going to the right time on a right way of physiotherapy, they can prevent a lot of neck and back pain. So here we are, and that is what I do.
Perfect. Understood. So why do you think people have neck and back pain a lot more? And why does it start showing after the age of 40?
So there is a science behind it. So our body basically means for a movement.
Yeah.
Okay, so our body, you can see the hands and everything is for a movement. And nowadays you see from morning till the night, all the activities, whatever we are doing, mostly we are doing in one place. Correct. We are not moving around. So movement is necessary for your body because movement itself is a medicine.
Yeah.
And nowadays our lifestyle, our work that way that we are not moving enough, and that is why our system not getting proper nutrition which is required for our muscle and bones, and that is why nowadays this disc pain, back pain, and joint pain are very commonly seen in early age. And after why 40? Because this is the usually age that your body started to age. That's why these problems are coming more after this age.
So the start of that happens very early in our life, but because of non-mobility, it starts to show up at 40.
I'll give you the example. Suppose you buy a Mercedes.
Yeah.
Brand new. Okay. 5 years under the warranty period. So this is the body gifted by the God.
Yeah.
The 40 years of warranty period, after the 40 years warranty is over. So you have to come to the mechanic, and that is what I do.
Oh, wow.
I usually tell in a funny way to my client.
Yeah.
We are a garage person. Your car we are fixing. I mean, your car is your body.
Your body, yes, understood. So your body needs a fix like your car needs a fix. That's exactly why you need to visit a physiotherapist.
Absolutely, when you're in the pain.
Okay. Now about physiotherapy, there are some myths, or people say that physiotherapy is what? We can just buy a machine and just do it by ourselves. Can you explain more about it? I'm sure people come to you also and say the same thing. अरे डॉक्टर के पास गए, पैसे बर्बाद कर दिए हमने, ये वाली मशीन हम घर पे ही लेकर आके कर सकते थे. So little bit more highlight on that.
So this is a really nice question. I'll tell you why. Because now in physiotherapy, what exactly mean by physio and therapy?
Yeah.
So physio itself is a physic. Your body or something. Therapy means treatment.
Yes.
Right? So physiotherapists are trained to use your body's healing channel to heal body's problem itself. And we study in very depth about the musculoskeletal. Now, you must be thinking, what is this musculoskeletal? So it's very simple way. Whatever things it is helping you to move your body. Example, you are all the ways moving hands, legs, walking, everything. So whatever function of the body involved in a movement, muscle, joint, nerves. So everything we study in the depth, and also we study the in engineering way how it's moving and functioning. So to understand that one, and if any problem happens, suppose you have a pain, so you're not able to move freely, pain free. Okay.
Yeah.
So to make pain free with using a body's physics with different techniques and advanced knowledge, that is called as a physiotherapy.
Physiotherapy. Okay, fantastic. Why did you choose this line as your line to proceed forward?
Which line you meant was?
Physiotherapy as
My profession.
a profession.
Okay, so behind that, there is one story is that.
Okay.
So basically that some incidents happens to my family.
Okay.
My grandfather, means my nanu, my mother's father got paralysis when I was in 6th or 7th standard.
Okay.
And he has suffered for almost around 7 years. We changed almost 30 to 40 physiotherapists, but none of them could help him. He got a paralysis and stroke. And when I was in a 12th, on the day of exam, he died.
Oh,
So I have a two-way, either to go for a funeral or to go for exam.
exam. Yeah.
So that day itself, when I went for an exam, okay, I had to choose the hard way. Okay. So I decided 80% convinced my mind, I really want to help anyone in this pain or any family like that. And that is why I choose to be a physiotherapist.
Oh, wow. So the profession that you have chosen is very close to your heart, I must say.
Yes,
So
I
you
can-
take care of your patients like family.
Yes. This is what we do at our clinic.
Yeah. Okay. That's fantastic. Okay. Now tell me, what's something most people don't understand about physiotherapy actually does to your body?
Okay. It's a really deep question. Can I go a little bit deeper?
Yes, please.
Okay. So in physiotherapy, first of all, what is physiotherapists are doing? Okay. So people doesn't know. If they have some problem, usually they go to doctors, they take X-ray, MRI. That's absolutely right. What they are doing is right. But they don't know, even in physiotherapy, we are highly trained to check you physically by physical assessment. So we check the movements and we can identify the problem is coming from where. Either is coming from muscle, disc, some nerves related tissue or something. So 80% of the problem when they come to the physiotherapy, we can identify by physical symptoms, and that we are matching with the X-ray and MRI when they required to do that one. So this is what we examine. Now, terms of treatment, if they have some issue, example, you have some issues here in the neck, so might be the problem is coming from the disc. So basically, we have a lot of problem, muscle problem, disc problem, so many things. So in physiotherapy, we have two way of treatment. The largely is brought in a two way. So one is electrotherapy that you mentioned, which is like machine therapy, like putting the machine. So in that also, so many different therapy are there. IFT machine, ultrasound. There is some laser machines are there. There are so many are there in the itself for the electrotherapy. And another part of this thing, it is called as a therapeutics. Therapeutics comes, one part is exercise.
Okay.
In that also so many are there. This is called as a strengthening exercise, aerobic exercises, stretching exercises. They are the therapeutic exercises, flexibility exercises, that one. Now, after these two, the third one is the specialized technique.
Okay.
Okay, so specialized technique, the mostly 80% people not knowing about what the specialized physiotherapy technique. So one is dry needle. Okay, we are putting the needle in the body to heal the things. We also, you see some sports player when they are playing like football or something. Okay, they have some coloring bands on the hand or legs or something. That is called as a kinesiotaping.
Oh.
That is helping you for recovery of faster muscle tear. Third thing, like advanced manual therapy. In manual therapy itself, there are 4 to 5 specializations. I have done specialization in Mulligan. So that is, some cracking you see.
Yes.
That also the part of manual therapy. And that also we do in terms of that is relevant to the healing of any joint problem.
Okay.
Then there is cupping therapy.
Yes.
Right, that you must have seen that one.
Yes.
Then there is one specialized technique when you have pain like a nerve pain, like you have impinged nerve which is giving numbness symptoms. So there is special techniques called as a neurodynamics. So neurodynamics also can release the nerve which is irritated from your disc. And still nowadays is coming more techniques. So there are so many techniques. Okay, we have so many different weapons to fight the battle. Okay, again, so whatever it's affected, whatever the problem is there in the body, so accordingly the need of the patient, we going to use either of this technique.
Okay. Could you give me one example, like one of the therapy you will use for one of the patients? What will be the scenario?
Okay, so commonly we'll take example for this muscle pain.
Yes.
Nowadays, mostly sitting job, they have this muscle pain,
Yes.
right? And I have commonly complained patients I had done physiotherapy last year, or I have taken something, but still again this pain is coming again. Okay,
Yes.
so now in this one, this is called as a trapezius muscle.
Okay.
So this muscle again is gaining strength because of your posture, because you are not working in a right function, you are not moving your body. So in this one, the cupping therapy is going to release the tight bands of the muscle. And I have the patients, they have some trigger point. Trigger point means the dead areas of the muscle because of long term of strain. So what happened when we put the needle particularly in that area, 5 years of pain gone in just a second.
Oh, wow.
And I can show you the result that one. And that's what we are doing. And I learned the dry needle technique. That is what I've specialized.
Yeah.
Okay, so that is I learned from world's best teacher who's writing the thesis on it.
Wow. That's amazing.
So most of the people, they don't know this kind of techniques are there.
And I think one of the reasons this pain merely comes and your neck pain is because of the usage of our phones that happens most of the time. And either we are in front of a laptop or in front of a phone and we keep holding. Like I have a friend whose hand is like her thumb is painful now because of the way she handles a phone all the time. So I think this is because of all those reasons,
Yes.
right?
I'll give you the live example for that one.
Yeah.
See, you are handling something on the hand,
Yes.
right?
Yes.
So your neck is like that,
Yes.
right? So mostly check yourself in a day how many hours you are like that.
Yes.
So that is causing the strain. If you put something one region particularly for 8 to 9 hours in a one position, what is going to happen to your
Happen to us. Yes. Okay, let me ask you another question.
Okay.
Now, my husband is someone in his 40s.
Okay.
And he always cries about his back pain.
Okay.
And I am sure you get a lot of people with similar symptoms, right?
Yes.
So could you stress us a little bit more? And for me also, because I am a plus size woman as well, for me, when I walk a little bit and after that, when I'm trying to sit, I also end up having a back pain. So what is it that is happening to us?
Okay. So for this one, this questions, I want to highlight something in your back spine. Okay.
Yeah.
So every spine there is a bones. It's made of the bones, and inter between there is a disc.
Yeah.
So disc is a structure like a pillow. So I'm going a little bit deeper into that one. So disc is a structure like a pillow, and this disc particularly have something kind of a semi-gel kind of a liquid inside.
Okay.
And one interesting fact is that this particular disc, usually I told you, we just discussed that after 40 your warranty is over.
Yeah.
Right?
Yeah.
But this disc warranty and aging process of the disc start when you turn to 22 to 25 years old.
Oh my God.
Yes. And that is why when that liquid of the disc is going to be decreased in a quantity and the capacity of the disc was less to take the weight of your body. And that is why it's starting to age and you have a on and off back pain and neck pain started in early ages now. And especially this is started with a morning stiffness. When you wake up in the morning, you feel your back and the neck, it feels tighter.
Yeah.
But if you move, automatically, you settle down.
Yes.
So itself, I told you, movement is medicine.
Medicine.
That is why you need to move. And that is why I keep the name of my clinic itself, Movement On Physiotherapy Clinic.
Oh, wow. Fantastic. So that is the problem of our mobility, and technical point that you have given us is a pillow-like thing that we have at the back.
In the disc.
And there's liquid to it, and that liquid starts reducing.
Yes.
So that is the reason we start having these back pain more regularly. What is one thing that we can do, like, a simple, easy tip for us where we can be better?
Okay, that's also a very simple thing.
Okay.
Always I tell my patient, solution is always simple. If you follow in the right way,
Yeah.
you did not to do anything complex things. If you just move your neck when you wake up in the morning, just 5 to 10 times up and down, left and right, and this way.
Yeah.
10 times, your problem solved. Same thing with the back.
Okay. Twist your back here and
twist
there.
your back, just
Yeah.
go front and back. That's more than enough. And
Yeah.
if you are that much lazy, if you're not able to have that much time,
Okay.
I am telling you directly.
Thank
know
you,
you.
Mr. Ravi.
So if you go for a bed in the night, just
Yeah.
simple exercises you need to do. Take your neck fully back and just do like this way 2 to 3 times. And you know that's in yoga, you lie down in Bhujangasana and just come in a cobra posture. Like chest up. So if you
Yes.
just do 2 to 3 times, so whatever strain, like suppose all the day you are like this.
Yeah.
So if you do this one, there is a reverse movement. So automatically whatever strain is accumulated in that tissue or area vanishes.
It's gone. Yeah.
So simple, but we are not even that following.
Yes. Consistency is the key.
Yes.
Which once we start doing it, we need to be regular. Okay. So tomorrow morning onwards, this is what I need to do.
I'm going to call you.
Okay, cool. Let's go to the next one. What's one habit or routine you swear by? Like something that you have a must do.
Okay. So this one, you are asking in a physiotherapist perspective, or what do you feel I should tell as a normal people?
I think give us both in terms of physiotherapy as well. And one thing that maybe you do it on a regular basis during your
Okay,
life.
fine. So I always tell to make your body in a healthy way, you need a movement.
Yeah.
Okay, so whenever you have pain or something like that, just try to move your body in any way. You just watch any YouTube video. Or
Yeah.
if you don't know anything, Surya Namaskar, if you do once
Yeah.
in a day, that is also more than enough.
Yeah.
And especially if you are suffering with any pain or something, one secret I'll tell you for any joint pain. Example, if neck or any shoulder pain and terms of physiotherapy. So to prevent any future pain, if you take all the pain, all the range of the joint in extreme once in a day, chances of having that joint pain in the future 90% reduces.
Oh, okay.
So example, your shoulder. Mostly nowadays people having winter frozen shoulder.
Yeah.
So usually we never take our shoulder in extreme range nowadays. We just take till there.
Oh, yeah.
So able to touch like this way? I don't think so. Right?
This is the
so
max.
if you take your shoulder both way,
Yeah.
okay, once in a day, so chances of having that kind of joint issue reduces 90%.
You are telling me to do just this.
Yes. And your
Okay.
shoulder pain can be prevented for a life.
Wow.
Same thing
Okay.
with the neck. If you take,
It can be solved.
yes.
So movement is one thing, and you're making it simplified by giving us these exercises, and that can prevent us from doing it. Okay.
Because ideally our mind is lazy.
Yes.
If I tell you to do 10 things, you will not do. But if I'll tell you just one thing,
One thing.
this is I simplified with experience. So this is
Okay.
very simple, you can follow.
Yeah, this is something I can definitely follow, and you can call me and check on me also.
Of course, I'm going to call you. I put a reminder.
Okay, let's go to the next question for you. What's one mistake you often see people make when returning to exercise after an injury?
Okay, interesting one. Okay.
Yeah.
So usually, when people get injured, they go to do physiotherapy, they finish it, and they are still in that mindset up, like they are like pro athlete like before. I'm just talking about the athletes, or some people, they are actually playing vigorous sports. So mentally they are like in that zone, but their body and reflexes are not still ready.
Okay.
Okay, so let's take an example. I have one client who has a knee surgery, ACL surgery.
Okay.
He started to play football again. He did some physiotherapy and he was fine. And he started to do some challenging drills.
Okay.
Okay, and that drills means his body is still not
Recover.
ready. His ACL is still not intact, and he started vigorously. So the prone to the injury, he re-injured the ACL. Okay, and we need to do the physiotherapy from beginning itself.
Oh.
And some kind of cases they also have to go for a reoperation or resurgery or something like that. So ideally, mistake people are thinking, unless and until your body is not giving you signal that you are confident to do that one, don't do it. So that is a signal I always tell patient. Okay, your body is smarter than anyone else.
Yeah.
If you feel not confident, okay, don't do it. Go gradually. Either it take more 1 week, but go that way.
Go that
Automatically will settle down.
Now, this is another question for you. Okay. When should people approach a physiotherapist? That is like, when we are in pain or when we fall and we have these injuries.
Okay.
Or is it something that we should follow? Like, once in a year we do our full body checkup, right?
Right. So ideally, if you ask me clinically, patient has to go when they have anything like paining for more than 2 weeks in the body.
Okay.
They should approach a doctor, their physicians, or might be a physiotherapist if they have a pain or something.
Okay.
And if it's settled down within 2 weeks, they don't require anything.
Okay.
Okay, so this is the first way to approach a physiotherapy. Okay, and if the pain is still persistent and you are avoiding, that means you are inviting so many bigger problems today or tomorrow. So ideally, within 2 weeks, if you have any pain in the body, shoulder, neck, back, or anything, you can approach physiotherapist or your doctor, so they can guide you from there.
Okay. Perfect. 2 weeks is the time when we have the pain. Within that 2 weeks, if it continues, we should approach a physiotherapist. Yes. Okay. Perfect. That's a good one. Okay. Now, Dubai is expensive for most of us. Okay. And I have a lot of my employees, so they do have pain and everything. But then they say, the medicines are expensive, or they will be like, insurance doesn't cover this. So is physiotherapy covered by insurance?
Okay. So in UAE, yes, absolutely. The physiotherapy is covered in majorly 70 to 80% insurances if your insurance is coming in a decent category.
Okay.
Okay. So mostly the insurance is covered.
Okay.
That is for sure. But we have to see whether that insurance is good or decent category. Okay. Another thing, I'll tell you the opportunity cost.
Okay.
I'll give you the example. One patient suffering from a neck pain, he has suffered for 3 years. Now he has that much pain, he could not sleep at the night.
Yeah.
He avoided for 3 years. Now the condition is that it's showing the MRI, the disc is coming that much out. He's starting to have a pain in the numbness in the hands. His weakness started. So if you see that patient, particularly now, he has to pass through might be surgery or might be the long-term of physiotherapy. Okay.
Correct.
So you need to see the opportunity cost as well. So expensive on this spot or long-term pain, you have to just count that way. So opportunity cost, he lost 3 years. Is in a pain.
Pain, yeah.
So people are not aware about it, and that is why they are just prolonging. Okay, this is minor pain. Let's avoid it. Oh, this is what the mentality of some people. They should not do it for a long time. Yeah.
Yeah. That needs to change. And I see that is changing. It's not like before that people just sit at home and heal ourselves, We become doctors at home.
That is why you approach me, na?
So you should take that responsibility and make sure that you go out there and use the services that are available for whatever health conditions you have. Okay, perfect. Is surgery always the best option for ACL for the knees, or physiotherapy alone can be enough?
Okay. This is an insightful question. So ACL, first of all, I need to give narrative what is ACL for the people to understand easy way. So in your knee joint, okay, there is a one ligament, it's called as a ACL. So what it does basically, ACL make the joint stable, knee joint to place in the proper way, whatever you're doing. Okay. So when you have ACL injury, is a ligament.
Okay.
So whenever injury is happening in the 3 grades.
Okay.
Grade 1, grade 2, grade 3. So if the injury is grade 1, we can easily identify or through the physical examination even, and also through the MRI. So easily physiotherapy can work and he can be completely healed with only physiotherapy.
Correct.
If ACL grade 2, okay, so grade 2 patients, 50% of the client, they usually recover with the proper physiotherapy for the long term. And still, if they're not recover and if they are athlete, they need to do very challenging, heavy work, then might they have to go for a surgery.
Okay.
And the grade 3, which is most severe, physiotherapy will not work. Hardly 20% cases I see is work naturally on some long-term physiotherapy, but I will not advise patient to wait too long. Go for surgery, then go for a physio rehab. That is more better approach. So if you ask me in that way, grade 1 and 2 can be easily treated with a proper physiotherapy and approach. Grade 3, better to go for surgery and then go for a proper physiotherapy.
Good insightful session with this particular topic. Now let's talk about some myths and facts. And I want to see what are your inputs on this. Good posture means sitting up perfectly straight all the time. जो होता नहीं है हमसे, but
That's what I'm supposed to ask you. If I tell you to sit like a robot like that,
yeah,
can you sit?
no.
Not possible, right?
Yeah.
Okay, so this is all school thought. So ideally, I always tell it's not 100% true. If you really want answer, just try to sit that way that your back, something touches to the chair part. It's
Okay,
more easy way. If
Okay.
I'm lying down also, but it's touching, no problem.
good one. Okay.
Not like a robot.
Definitely not. And I don't think anyone can do it. But again, we have Google Baba right now, right? So
Chat GPT, advanced version.
advanced
He's
version.
the son of Google. That he used to say.
Correct. The next question: sitting is the new smoking.
I agree with that one.
Yeah, even I agree with this.
Yes, okay. Even people are actually having more pain due to this sitting jobs.
Yeah.
That's 8 hours, 9 hours. Our body is meant for movement. It's really true, and you should avoid it. Continue sitting. So I'm not telling you cannot sit,
Yeah.
but try to have a break in between.
So I know a lot of YouTube videos will be there available for us. How can we make mobility easier in a desk job? Someone who has to be in the customer service and someone who has to, there are customer service job where people have to stand, but this is more on a sitting position.
Okay.
How can we make it easier for them?
I can make it easier, very easier that you can follow. You need to drink a water.
Yeah.
Okay. Let's take an example for water bottle.
Yeah.
So this water bottle, it is in my reach,
Yeah.
right? I'll keep it at that side. So from there,
Yeah.
I can see, but I cannot take it.
Yes.
Okay. And you put it one timer for every 1 hour in your mobile. There is a timer for you to get up and go to the drink water, sip of water and come back.
Oh yeah. This is the easiest way people can move.
Yeah. If I'll tell you to do no generic, they will not move. So this is the solution I found for all my client who's having more sitting job. Put it water bottle or something, just you can see, but 2 meters away. So every 1 hour, put a timer. That timer is rang. Go there, drink, come back.
Okay, now because you showed me water, that's why my next question to you is how many liters of water an ideal person should drink? And is it like age appropriate or is it like normal for everyone?
I can say generic range, ideally 2.5 liter to 3.5 liters.
Okay.
But of course, it depends on your physical activities. Like someone who's just sitting, 2.5 liters is enough.
Enough for
But
that.
someone is actually too much active physically, they need more water because dehydration is more. And specifically in Dubai, sun,
Yeah.
so there is naturally too much of dehydration is happening. So I guess for Dubai 2.5 to instead of that 3 to 4 liter is more better approach.
More better. But it becomes difficult for us to drink 3 to 4 liters of water. Certain people, yes. For me, even that 2.5 liters of water to drink, at times it becomes difficult.
Okay.
But that is an average, you are saying. 3 liters
2
to 4
liter
liters.
is also okay if you are sitting. That's okay.
Yeah?
Yeah. That's not compulsion rule, but ideally you need to be hydrated oftenly.
Okay.
It is not something that you drink altogether.
Resting too much can slow the healing process.
Yes, it's exactly right. Because if you rest, okay, initial it's okay.
Yeah.
When you have acute injury, you just got injury, 2 days rest is okay. But nowadays I see the people, they're resting too much. No, I have a back pain, Baba, I cannot do anything.
1 week of sleep
Yes.
at home.
Yes.
Anyways,
So-
mobile is in our hand, right?
So that is not right approach. If you move, automatically the blood circulation surrounding that muscle started and the healing process a little bit more faster.
Okay.
So ideally you need to move gently, that not causing the pain. So that is a better approach.
So it is 2 to 3 days of rest is good enough. After that, mobility has to start.
But condition apply, it's goes condition to condition.
Condition to
Okay,
condition.
that you take an opinion of your doctor or physiotherapist properly, then accordingly follow.
Okay, perfect.
But don't make it excuse your husband, I have a back pain. My doctor told me 1 week. No doctor is telling for 1 week and I'm not telling. Some of the husband calling me, doctor, what you told to her?
Don't get out of the bed for 1 week. That is such a nice thing to say. I hope all the doctors approve that request. For wives only, not for husbands. Okay, let's go to the next one. Lifting weight is a bad for joint pains.
Okay. So lifting is not bad, 100%, if you do with a gradual.
Okay.
Like suppose my first day in a gym, I started with a 10 kg weight directly. It's not good. Okay.
Yeah.
For your muscle, even for your joint. But I started with the 2 kg. 1 week I follow 5 kg, 10 kg. So if you increase the joint muscle mass or something, it's actually good for your long term things.
Okay.
And if I tell you one thing in the line, after the age of 40, the best investment in your health, particularly, it is your muscle mass. If you have muscle mass, you are a wealthy person, healthy wise.
Yeah.
If you have less muscle mass, nowadays I see the protein content is so less, it is very dangerous. You have on and off pain in your body.
In your body. Okay. So after 40, muscles are something that you should be
The muscle
having.
is dilute. Muscle
Yes.
dilute. If
Yeah.
you don't do the gym and if you something you're not doing exercise, muscle going to be dilute.
Yeah.
And the weakness is going to happen, and that's more prone to having age related problem, arthritis, and joint health also not good.
Correct.
That is why we always tell to go gym, make the muscle.
Muscles. Okay. Perfect. Massage guns can replace proper
I was
rehab.
expecting this one from you.
From me? Okay,
Massage,
cool.
yeah. So massage gun, it can replace what exactly now?
Massage guns can replace proper rehab.
Okay. If it would replace, I would not in front of you, or I would not run my clinic, right?
It's
So-
like time management plans, right? There is someone else's law, then someone else's law, then 20 minutes law, same like that.
Okay. So massage gun definitely cannot replace. If you feel that way, there is a psychological you are thinking. But yeah, if you have minor things just for your fun or relieving, massage gun definitely is good, but it's not going to definitely replace that something have a complex issues.
Okay.
So don't rely on massage gun only.
Okay. Don't buy one in the beginning.
No.
First go to the physiotherapist and
No,
then
no.
if he recommends, then you can.
I'm not telling that.
Okay. So what is your suggestion is massage guns are okay to
Are
keep?
good. Yeah, like
But-
for if you don't have any issue, if you do it, it's good.
Yeah.
Okay. And if you have minor pain, it's working. But I told you now, rule is same. 2 weeks still you have a pain, massage gun it's not right. You have to go to check with a doctor and physiotherapist.
Perfect. Screen time only affects your eyes, not your body. My eyesight is very weak.
Okay. So in this one, I want to go a little bit deeper.
Okay.
We think like no, the blue light which is coming from the mobile, it's only affecting you. But when you're using mobile for a long time, your this part is always tense.
Yeah.
Okay, so nowadays I see the people coming in the clinic, they usually have neck issues without any particular showing something in X-ray or MRI, and that is related to use of the mobile. And they also have insomnias, lack of sleep, and headache also coming from the tight muscles from the neck.
Correct.
It's not only affecting your eyes, but if you are doing overly continuously, it can also cause your neck muscles problem, also headache as well.
As well. Okay. So screen time can affect a lot of things. So
Yeah.
make sure your phones are off by 10 p.m.
That is up to you, what you feel comfortable, but
Yeah.
usually that's true.
Okay, cool. Now this is an interesting one. Hot shower or ice bath? Which is more effective for your body?
I'll ask a question.
Okay.
Wife is better or husband is better? Which one?
If you ask me, the wife is better. If
Yeah,
you ask
sorry.
my husband, the husband is better.
No, not to you, but for normal people, wife is better or husband is better. Okay. So everything has their own importance. Okay.
Yes.
Hot shower, if you take it, if you get tired normally in the end of the day or when you initiate the day, is really good for regenerating your body,
Okay.
to make your body to come in the active mode. Okay.
Yeah.
Where cold, it can refresh your whole system in the body. Yes. So ideally you take hot shower, it's okay. But once in a week, ideally I always advise my client to take a normal tap water bath, or they can go for nowadays this coming now
Ice bath.
ice bath challenge.
Yeah.
So at least once you should do that one, because it's going to be increase the metabolic rate of your body.
Really?
So if you have some problem in your metabolic problem or some minor disease, this refresh switch can do that one like natural healing.
Okay, so both have their advantages and disadvantages.
Like in a computer, if you stuck, we could do the refresh. So this is a refresh button of your body. That cold one is a refresh button, cold bath or something.
Perfect. It was a wonderful session with you. You answered majority of our questions. And I just want to mention one thing to you. I don't think I would have had you in front of me today if it wasn't for the platform of BNI. I think that is when we met for the first time and it was an instant connect. And from there, we were like, let's do a podcast. So I think BNI is that platform that gave us that opportunity that we are in front of each other today and we know our network. What do you say about that?
Absolutely true about it, because when I see you in one chapter meeting and there I go, I am just like, like the energy and the vibe,
Yes.
always. So I see that positivity and energy in you that makes me to come to and talk to you, and then I got to know about you, and it's so wonderful that we have this platform, and thanks to BNI as well.
Yes.
And thanks to you as well to hosting me today. It's my pleasure, to be here.
Perfect. At the last time, do you have anything else to tell our audience?
Okay. So I always tell my client and all the people, keep moving, because movement on, pain gone. Movement itself is a medicine for your body.
Perfect. Thank you, doctor. You were of great help and we got lots of insights today.
Thank you so much.